Hello from Singapore. My name is Gerlinda. I've never done a video before. This is the very first time. I'm also not sure whether anything interesting will come out of this, but I guess time will tell. Today is April the 7th, day 1 of the circuit breaker, something like a semi-lockdown here in Singapore. A little bit about myself. I live in London and I work as a postnatal maternity nurse and nanny. I travel with the families I work for. I left London in November 2019 with my employers. We were in New York City, the Bahamas, and Miami, Florida. I have not been home since. On March the 13th, we flew from Miami to Singapore. We were requested to report the history of our travels upon arrival, the history of our travels in the last 14 days before our arrival. Before getting to the immigration counters, our temperatures were taken. None of us were issued any stay-home order. That came after a few days after we arrived. We were free to move around. Everything was still operating as usual. Shops were open, restaurants and bars, where everything was open. I was able to walk to my employer's home every day and return to the hotel that I am staying in. On day 13th after my arrival, I woke up coughing. Actually, I was coughing all night that night. My nose was blocked and I had some stomach problems. After speaking to the receptionist at the hotel, who was very, very helpful, she advised me to go across the street to consult Dr. Chan Peng Moon. He prescribed me a bunch of medication and told me to go back to the hotel and rest. 2 hours later, while I was resting in my room, the Dr. Chan called me back and told me that he has spoken to a specialist and suggested that I should go to the Mount Elizabeth Novena Hospital for COVID testing. He also scheduled an appointment for me on that very day in the afternoon. At the hospital, I was greeted by a team of nurses who were wearing full protection gear. They were very, very nice, very, very friendly, and very, very considerate. My temperature was taken, oxygen was measured, breathing was measured, and I was asked to wait at the designated waiting area, which was set up outside of the main hospital building, away from the main entrance, where people line up to enter the hospital. I met with the infectious disease specialist, Dr. Leong Ho Nam, a fantastic doctor, not knowing that he is the specialist in this field and famous not only for his professionalism, but also because he was previously one of the infected persons during the SARS pandemic, and he survived to tell the tale. In 2003, 17 years ago, Dr. Leong was 32 years old, and he was attending a conference in New York City when he developed symptoms. He was taken off his flight back to Singapore. When he was transiting in Frankfurt, Germany, he was immediately taken to hospital and was isolated for 2.5 weeks before he was able to return to Singapore. Saying that, he became patient zero in Germany, the person who brought SARS into the country. Dr. Leong was very, very kind and very, very patient with me. He listened to the details in my answers to his questions. He examined me before taking out 2 swabs the length of 3 Q-tips. He swabbed my throat first. He commented that they were quite inflamed. And then he put the other swab through my nostril, through one of my nostrils, sticking it all the way up to my nose. It felt like it was tickling my brain. It was an indescribable sensation, not painful, but very, very unpleasant. Within 24 hours, the result came back and COVID-19 was not detected. What a relief. So back to day 1 of the circuit breaker here in Singapore for 1 month. Today is day 1. I did not sleep very well last night. I woke up very early this morning and I was Googling in bed to read some articles online. And I came across this very interesting article posted by the Straits Times. This was written by Karamjit Kaur. I hope I have pronounced her name correctly. If not, my apologies. She has put together some very interesting facts that I would like to share with you. It's only been 10 weeks ago when Singapore confirmed its first COVID case. On January the 23rd, a 66-year-old Chinese tourist from Wuhan was tested positive for COVID. About a week later, the first Singaporean, a 47-year-old woman who had traveled to China, was tested positive for COVID. On February the 3rd, the Ministry of Health in Singapore reported the first local transmission, patient number 19, a young 28-year-old Singapore resident who had not been to China, was also tested positive. As of noon yesterday, Singapore reported a total of 1,375 COVID cases, more than 30 virus clusters around the island, and 6 deaths. Now, compared to the rest of the world, Singapore has done extremely well dealing with this pandemic. And I feel very, very blessed and I feel very, very lucky that my work has brought me to such a safe place. At this time, I'm very, very thankful that I'm not in London.